Joining us today is Dr. Randall Williams, our department director, to answer a few questions that you may have as we enter flu season and how flu and COVID relate. So, to start off, let's talk about how are flu and COVID-19 different?
Yeah, thank you, Megan. It's a great question. We had a patient or employee who last spring presented with the flu, and classically the flu kind of hits you like a ton of bricks. It's a fever, maybe chills, you don't feel good, and it just comes on real suddenly. COVID-19 can do that, but as a rule, it tends to be a little more insidious. And that's one thing we run into, and we saw that recently, is where, you have kind of cold symptoms, you have kind of a cough, you might have a low-grade fever, and then that might get worse. So the first thing I would say is that the flu, as a rule, not always, tends to be much more rapid in onset. The second thing is, there's a big word we use in clinical medicine, which I did for 30 years, called pathognomonic, meaning the symptoms are indicative of just one thing. And for COVID-19, the loss of taste and the loss of smell is pathognomonic for COVID, not the flu. Now, most people who have COVID-19 don't lose their sense of smell or taste, but if you lose those, it's pretty sure that you probably have COVID.
All right. So now that we've talked about how they're different, another question employees had was, well, lots of people say that COVID's like the flu, but we know that it's not. So why did COVID cause the shutdowns and physical distancing and wearing masks?
Yeah, it's a great question, and the first answer is obviously with COVID-19, it was a new, novel, emerging virus, and we just didn't know. How's it going to affect children? How's it going to affect pregnant women? How's it going to affect our senior citizens? So in an abundance of caution with a novel emerging virus, whether it was H1N1 or Zika or anything else, we tend to very much put in very precautionary measures. Now, as we've moved forward, what we've seen from COVID-19 is it very much disproportionately affects our senior citizens, especially those with comorbidities, to a point that they have much higher mortality and morbidity. On the other hand, unlike H1N1, it doesn't appear to affect children as much, and certainly we don't see the morbidity and mortality that we see in children that we saw with H1N1. So I think the quick answer is that in any novel emerging virus where there's no immunity, we're going to take more precautions than less. And then I think the other thing is it's just a unique characteristic of this virus that it is more lethal and has more morbidity than the flu.
All right. And we're headed into flu season. So we know we should get our flu shot. Why is that especially important this year?
Yeah, it's important for a couple reasons. One, we just think that we want people to be as healthy as they can while this other virus is out there. So normally about half of Missourians get their flu shot. If we could get that up to 60%, that's associated with herd immunity. And so that would be just really good for everybody. The second thing is that, as Megan was just saying, it really decreases the burden on our healthcare system if doctors aren't having to figure out what you have. And I can tell you, for practicing for 30 years, and this patient I was talking about in the spring, the first thing I asked her was, have you had a flu shot? Because if you had a flu shot, that immediately helps me think, well, maybe this isn't the flu. Now in her case it was, because even with the flu shot you can get the flu, but her course was much, much more benign than you normally see. So it's important for that reason. And then the third reason is obviously the thing we're trying to avoid the most is what we call crisis care, where we don't have enough beds, we don't have enough ventilators. And so anything we can do to decrease the number of admissions and the number of people who are sick, whether it be from the flu or COVID, very much helps our hospital and our overall healthcare system.
All right. And can we just go, quick reminder, who all needs to get their flu shot?
Yeah, I think anybody over 6 months, unless you have a very limited reason not to get it. So it's pretty much everybody, children, pregnant women, seniors, essential caregivers. All of us need to get our flu shot. I got mine on Friday, and I'm very appreciative of getting that. And so it's pretty much everybody.
All right. Sounds great. Thank you so much for joining us.
And thank you all again for everything you're doing. Stay safe. And I think one great way to do that is to get the flu shot. So thank you.